Patty, and I'll turn it over to you.
Thank you, Rob. It's been a pleasure to be part of your Disruptive Women's blog, although I haven't been able to participate as frequently as I would like to have. But the idea is terribly important. Because you don't make change if you keep doing the same thing. And if we keep doing the same thing in health, and we may, you know, in England, everybody has an electronic health record. Every doctor. And it works. No change. No change. Why? Because the record tells the doctor what he already knew about the patient. It's just a little more efficient. But it doesn't tell the doctor what the other doctors know. It doesn't tell the doctor what the patient knows. So real change is about changing relationships. And I've come to the conclusion, I've been very active in health information technology. As you all know, I was delighted the bill was passed. I think that's very, very important. But I've come to the conclusion that we're missing something really important as we talk about health reform. We are missing the patient. Where are the big health systems that are successful, the health IT systems? They're in Kaiser, they're in Intermountain, they're in systems that are already closed, and some great hospitals. We have not one example of an interoperable system where unrelated doctors can bring together your information. We have only one example that I know of a system in which the patient has total control of the record. And when you get to the point where genetics matters, and right now they can actually test you genetically to see which of 3 drugs will actually help you if you have a number of different severe psychiatric problems. So imagine the difference between someone with a really severe case of schizophrenia going through a drug that isn't going to help them when you could have taken a test that showed that they have no receptors for this drug. So personalized medicine is booming along, kind of out of sight. And it's not only about science, but it's also about people. So my daughters are choosing walk-in clinics because they don't have time to make the appointment, take off from work, get the kid, disrupt their activities. Patient power is going to be a disruptive force in healthcare. It's going to be part of what actually reconfigures the care team. Because once the patient knows everything the doctors know, and the communication between them is absolute, consistent, easy, and ordinary, which it can easily be through the internet and a secure system, they are going to be a far more active participant. Doctors will tell you, they diagnose a serious disease, and the next time the patient comes back and they've read everything on the internet. And the doctor is now accountable for a different level of care to explain exactly how your disease and your health are at issue with the diagnosis that he gave. So the role of the docs, if the doc's going to talk to you like that, he better have more time, right? But we've got all of these well-trained people. Years ago, I got these people covered under Medicare, hoping to see that dynamic change, hoping to see the highly trained nurse practitioners and advanced practice nurses and psychiatric nurses, physician assistants, take more of the burden. But you see, the payment system didn't allow it. And even when I allowed those payments, it would just, it didn't work, see. So now that we're looking toward care teams, we're looking toward cross A, cross B payment systems. We're looking at outcomes. We want to know longitudinally, what's wrong with the patient and what's going, and prevent it. Now, the real reason the patient is going to become the most important person in the healthcare system is because you can't do prevention without them. That's why it would be a terrible mistake in healthcare reform if we projected into the future the type of plan that has failed us in the past. That is, an insurance plan that has deductibles and copayments across the board. That is the old world. The new world is, if you get all your preventive care, your premium goes down. The new world is you have a chronic disease that requires you to be methodical, precise, and accurate and consistent in self-care. Free drugs for that. Free drugs for diabetes. Free drugs for, and in fact, Pitney Bowes does that. You get diagnosed with a chronic illness. You get free drugs. But you have to take your responsibility to implement the discipline that's associated with the chronic illness you have. But it's very exciting, and you know what? It saves Pitney Bowes money, and the patient does much better. The patient does better because they have access to the tools to help them to do better, that is the medications and the medical advice, but also because they have the support and the re-education, the knowledge to care for themselves. So don't underestimate. I mean, if chronic disease is 80% of the dollars for 20% of the patients, and that's roughly what it is, whether you're talking the elderly or whether you're talking private sector, you cannot cut costs without doing damage to access to care and damage to the dynamic development of medical science in America unless you get that 20% was using 80% of the dollars to think. And you give them the power of knowledge to know. So only through managing chronic disease, which is getting the patient involved, which is educating them, and see, these are the tools. I was talking with the head of a medical center in Houston yesterday, and they have, we were talking about residencies, you know, and cut and dried stuff, boring, but they have a neuroscientist who now, and see, CAT scans can give us the power to see a small thing in your brain that might precipitate a stroke. He now has the technology, just like with heart, for now him to go in with these micro things and take out that little thing, and you never get the stroke. Prevention at an extraordinary level requires a team of 12 residents and all this machinery and equipment. Also, if you have a stroke, he can go in and restore a lot of tissue, and you can regain, you know, speech, walking, lots of your capability. People are going back to work. People are regaining control of their lives. Think of the money saved, and think of the quality of life. But that's the extreme end, see. Now, if you start at the other end, and you're able to identify problems that children have in learning before they even get to kindergarten, they are going to learn a lot more in kindergarten. And then they're going to do better in first grade, and they're going to be a better educated, more capable, more fulfilled individual. So prevention is extraordinarily important in our lives, not only from the health perspective, and basically we don't even talk to kids about preventive health when they're little. We don't require anything of them. And yet, that's when they set their habits about diet and consumption and sleep and activity. So look at these games and see how they restore. I mean, it makes my heart break to go visit my grandchildren and realize that some of my children can't let their children run out and play. I mean, my kids had full run of the neighborhood, and they played hard. And whatever parents' yard they were in was responsible for watching this flow of ants around the neighborhood. And it was wonderful. The personal responsibility, the physical activity, you know. And most kids now can't do that. And most women at home can't do that. So we're all sort of going to pot. Well, if you go to pot physically, you go to pot mentally. I mean, I used to tell kids in school, don't tell me about how smart you are unless you tell me too about what game you're playing and what challenge you're taking on physically. Because you just can't have one without another because your body's of a piece. So these kinds of things are going to help us all stay healthier, and they're going to help us identify earlier why some of us are having trouble staying healthier. And you know, it's like anything else. The earlier you understand it, the better the course of recovery and the greater the ability to sustain the recovery. So this is a very wonderful development of technology, because instead of just cartoons, I mean, my grandson, my oldest daughter, rations the time he can play Wii. I mean, it's exercise, but it's so absorbing to him, you can't get him away. And so It is wonderful to see the diversity of opportunities that we're now making available to ourselves of all ages. I've been very impressed with the groups in Hartford that have developed all kinds of things for elderly to do to keep their minds growing lively. So we're not limited to the crossword puzzle. So I'm glad you're here, and we have a real challenge to integrate what we're learning here today with health reform, so we come out with a transformed system of care in which patients can do better, not just recovering from a disease, but all their lives.